And it is coronavirus day 444, and staying home to day 53. And just a mental note, due to risks and a possible wave 4, don't have any gatherings until, like, the phase 1 thing starts. Then you can start meeting people outdoors. So that the max number is for you can have up to 10 people and in a gathering outside, and from different households, not just people from the same household that you. So it could be like, yeah, you can meet up with your friends. Just keep it under 10. So just don't have any right now, because who knows who might get affected. Okay, Ontario's coronavirus cases is lower than yesterday's with 1,033. Oh, so that's better. So 237 cases are from Toronto, 214 is from Pure Region, 80 from York Region, and 59 is from Hamilton. So all other regions are reported under 55 cases. So okay. That's 18 deaths have been reported today. So okay. So variants, okay. The UK variant, our biggest threat right now, looking at it. 125,035 UK variants exist right now, an increase of 863. No, technically the third, the second variant on our hands, which is now actually the third lowest variant, if you count. In third place, but lower than coronavirus case. Daily coronavirus cases, looking at it. Now, the South African variant is at 947 cases, an increase of +2. Brazilian variants are technically the second highest and our second biggest threat, is at 2,814, an increase of +20 compared to yesterday. And of course, the India double-mutant variant has not been updated, and the government has not done much. They updated it when Brampton got affected with 36. They updated it when Ottawa affected with 141, plus additional 2 deaths. But the 45, where did that come from? Where did that come from? I don't know. So, vaccination. So, you want to get book a vaccine, 18 plus right now. So, starting tomorrow, youth 12 to 17 can also be included in the people getting vaccinated starting tomorrow. So, but you can do it through you can book through covid19.ontario.ca/book vaccine through the toll-free number 1-888-999-6488 at a pharmacy. You'll have to wait though. Through local health units networks for use 12 to 17. They can do that through the provincial portal, the website, toll-free number, pharmacies, and special dedicated youth and family clinics, and especially on Tuesday, youth vaccinations are available at pop-up clinics, mobile clinics, and walk-in appointments on Tuesday. So, youth not aged 12 right now, they can book for a later date through the toll-free number 1-833-943-3900 or through public health units. Stay-at-home order and June 2nd. We don't know when the 3-phase plan starts, but I think it might be starting on a Saturday. I could be wrong, but we'll see. I have all the phase 1, 2, 3, information down below. Okay. So my topic today is I want to talk about is Manitoba ICU patients. So this is not the first time I've talked about Manitoba ICU patients. So Manitoba apparently the intensive care unit are grappling with the staggering high number of coronavirus admissions, and more people were getting sent into their ICU, resulting in them having to send patients into Ontario hospitals. And of course, they, patients had been sent from a hospital. That have been sent to Thunder Bay, hospitals in Thunder Bay, to Ottawa, out east. and Sault Ste. Marie, yeah, North Bay, in the North Bay Parry Sound region, yep, and then some have been transferred to Windsor, near, next to, America's Detroit, and also London, Ontario, and in the London Middlesex region. So shared health, the health unit in Manitoba, there's 225 patients have been admitted to Manitoba's ICUs this month. And apparently 123 patients were receiving a critical care in Manitoba. And then now they so they also sent patients to Saskatchewan, the province next to Manitoba. So there's been additional people that sent to Ottawa, Owen Sound, Markham, and Sault Ste. Marie again too. And the problem is there needs to be more critical care nurses in Manitoba to treat Manitoba patients in Manitoba, instead of having to send them over to out west to Saskatchewan or east to Ontario. So Markham, so that's literally just right above Toronto. So I'm not so sure if that's getting safe or not safe, but yeah, we'll see. But York region has been having some low coronavirus cases, so that's been good. And of course, we've already Ontario already accepted Manitoba ICU patients in Sault Ste. Marie and Ottawa too. So. And I haven't seen Ottawa on high cases list every day. So for right now, so we're on a good run. So shared health is just is telling people of Manitoba to it's critical that Manitobans follow public health measures and stay home as much as possible, regardless of whether they have been vaccinated or not, or partially vaccinated. So this puts pressure on Ontario, and so can we deal with this? Hopefully. And it's just unfortunate that they have to transfer patients to other provinces to get treatment here or in Saskatchewan. Because there wasn't enough room. So although it's technically worse than being transferred from all across the province to another hospital, and it's sort of looking at that transferred from one hospital in one part of Ontario to another hospital in another part of Ontario. Compared to that, and the Manitoba being transferred here for treatment, ICU care treatment, yeah, it's different, but both suck. I understand. So, just a reminder, the EMCPA rule is still in effect. $750 per person for those if you're having a gathering large, and sometimes $130 surcharge, $880 through if through ride checks, which is like a certain checkpoint, so they don't literally do random stops or anything. It's just at a certain stop, you go through this area, they have a ride checks point here, they have the right to stop you 100% legal too. $1,000 for trying to prevent others from following orders. $10,000 for those who organize or plan the gathering. $1 million if severe and possibly even jail time. Hospitalizations, okay. Luckily, it's lower with 749 people hospitalized with coronavirus, minus 185 compared to yesterday, so it's sort of going down, okay. 614 ICU patients, minus 12, okay, good news. 417 ICU patients using a ventilator, minus 21, that's okay, good. And of course, they have still not updated the long-term care home data. Like, no death updates, no staff death changes, updates, no outbreaks. So here's the stuff from May 27th. So, anyways, please follow coronavirus safety rules and regulations, and stay at home rules. Don't have any gatherings for the safety of others, and also because of the Manitoba ICU patients being transferred over here, and let's not forget about our own ICU patients. Let's get them treated and vaccinated. They're up, they're on their feet. Stay safe. If you haven't registered for vaccines, please do so. And I noticed that, so even though you do get a paper copy of the vaccine receipt and also PDF form, but you will not all people will get a "I got vaccinated" sticker. Well, like, some people got it, some people didn't. I didn't get it. Some people got it. Just as a heads up, okay? And sometimes, like, you might might feel a bit tired in the arm. You get the vaccine shot, and then you might get tired, or you might get dizziness, but you can get over it.